Hello everyone, now let us discuss about 2023 ICD 10CM coding guidelines for Chapter 15, Part 8. In the current session, we will be focusing about the sequelae of complication of pregnancy, childbirth and puerperium, which is given by the code 094, and guidelines regarding the termination of pregnancy and spontaneous abortions. By this, we complete the Chapter 15. Now coming to code 094, sequelae of complications of pregnancy, childbirth and puerperium. So the guidelines are when must be used, the code 094. The next is after the initial postpartum period, even if the complications arise, what must be coded. And finally, the sequencing of code 094. First coming to code 094. The code 094, which is nothing but sequelae of complication of pregnancy, childbirth and puerperium, is for the use in those cases when an initial complication of a pregnancy develops a sequela or sequelae requiring care or treatment at further date. When a initial complication of a pregnancy, whenever it develops a sequela or sequelae requiring care or treatment at further date, then code 094 must be used. And the code may be used at any time after the initial postpartum period. This code may be used at any time whenever the sequela arises. That is not only limited for postpartum period, but it may be used at any time after the initial postpartum period also. And coming to the sequencing, this code, like all sequelae codes, is to be sequenced following the code describing the sequelae of the complication. First, the condition must be coded and this must be coded as secondary diagnosis. This code, like all sequelae codes, is to be sequenced following the code describing the sequelae of the complication. Here you can see 094, sequelae of complication of pregnancy, childbirth and puerperium. One important note is this category is to be used to indicate conditions in the categories 0002, 077 and 085 to 094 and also 098 and 098 as a cause of late effects. The sequelae includes conditions specified such as late effects which may occur at any time after the puerperium or postpartum period. Code first the condition resulting from the complication of pregnancy, childbirth and puerperium. First the condition must be coded, then the code 094. Now let us briefly discuss the definition of postpartum period and sequelae. The postpartum period, also known as puerperium or puerperal period, is commonly defined as 6 weeks following delivery. Postpartum indicates 6 weeks following the delivery. And sequelae, on the other hand, it does not have a clear cut in terms of time frames. There is no particular time frame for a sequelae. It can occur at any time. And a sequelae is defined as a residual effect, that is condition produced after the acute phase of an illness or injury that has terminated. And there is no time frame on when a sequelae code can be used. The residual may be apparent early, such as in cerebral infarction, or it may occur months or years later, such as due to a previous injury. There is no particular time limit or time frame on when a sequelae code can be used. Now let us see an example. Patient chart indicates a previous diagnosis of hyperthyroidism and goiters in pregnancy. Here the pregnancy is complicated by hyperthyroidism and goiters. And the hyperthyroidism continues to persist 3 months following the delivery. And patient is now experiencing associated atrial fibrillation. Atrial fibrillation is a sequelae of hyperthyroidism that has occurred during the pregnancy. So the first code is the condition I48.91, unspecified atrial fibrillation, followed by 094, Sequelae of Complication of Pregnancy, Childbirth and Puerperium, and then E05.90, thyrotoxosis unspecified with or without thyrotoxic crisis or stop. This is to indicate the hyperthyroidism. So here, first the condition is coded, followed by sequela code, that is O94 code. Now coming to the next guidelines that are related to termination of pregnancy and spontaneous abortions. So here we will be discussing 4 categories, subcategories. Guidelines regarding the abortion with live-born fetus. The second is guidelines regarding the retained products of conception following an abortion. Next, complications leading to abortions. And finally, hemorrhage following elective abortion. This is a new addition from 2022 October. Hemorrhage following elective abortion. Now coming to abortion with live-born fetus. When an attempted termination of pregnancy results in a live-born fetus. Assign the code Z33.2, encounter for elective termination of pregnancy, followed by code from the category Z37 to indicate the outcome of delivery. Second guideline is retained products of conception following an abortion. Subsequent encounters. For the subsequent encounters for retained products of conception following a spontaneous abortion or elective termination of pregnancy without complication, you need to assign either the code O03.4, which indicates incomplete spontaneous abortion without complication, or O07.4, which indicate failed attempted termination of pregnancy without complication, in order to code the subsequent encounters for retained products of conception following either a spontaneous abortion or elective termination of pregnancy. And this advice is appropriate even when the patient was discharged previously with a discharge diagnosis of complete abortion. That is, even after a discharge diagnosis of complete abortion, after 2 weeks follow-up, if the physician finds some of the retained products of conception, they can again go for DNC. In that case, you need to use these codes for the subsequent encounters for retained products of conception, O03.4 and O07.4. This is appropriate even when the patient was discharged previously with a discharge diagnosis of complete abortion. Even after the discharge diagnosis of complete abortion, if the physician finds some of the retained products, the patient can get readmitted and undergo a procedure to remove the retained products of conception. If the patient has a specific complication associated with the spontaneous abortion or elective termination of pregnancy, the previous codes are given when there is no complication. And if the patient develops a complication due to the retained products, then assign the appropriate complication code from the category O03 or 04 or 07 instead of O03.4 and O07.4. Now coming to guidelines regarding the complications leading to abortion. Codes from chapter 15 may be used as additional codes to identify any documented complication of the pregnancy in conjunction with codes in category O04, 07 and O08. Additional complication codes can be used along with these codes. Now here you can see the table which has the all codes that come under the category Z37, which indicates the outcome of delivery. Whenever abortions result in single live birth or a live birth child, then you need to code additionally Z37 series to indicate the outcome of delivery. Here you can see the various descriptions of the various codes that come under Z37.0. If it is twins, one live born and one stillborn, the code is Z37.3. If it is twins, the outcome of delivery is twins, both stillborn, the code is Z37.4. If it is triplets or live born, the code is Z37.51. For single live birth, the code is Z37.0. Like that, you can refer this table for the outcome of delivery codes. Whereas Z37.9 indicates outcome of delivery unspecified, or NOS for multiple birth, or NOS for single birth. Here you can see the various codes for termination of pregnancy codes, both with complications and without complications. O03 category indicates spontaneous abortions. It can be incomplete or complete. Whereas O04 indicates complications following termination of pregnancy. That is induced termination of pregnancy. Whereas O07 indicates failed attempted termination of pregnancy. And category O08 indicates complications following ectopic or molar pregnancy. These are the various categories which govern the termination of pregnancy and spontaneous abortion codes. In the current session, we will discuss about each and every description of the codes of category O03, 04, 07 and 08. So first coming to O03.0, it indicates genital tract or pelvic infection following incomplete spontaneous abortion. If the physician document endometritis or oophorytis or parametritis or pelvic peritonitis or salpingitis or salpingo-oophorytis, all these terms following incomplete spontaneous abortion, then the code is O03.0. Next is O03.1. It deals with delayed or extensive hemorrhage following incomplete spontaneous abortion. And whenever the physician documents fibrinogenemia and defibrination or hemolysis or intravascular coagulation, all these terms following incomplete spontaneous abortion, the code is O03.1. Next, O03.2. Embolism following incomplete spontaneous abortion. If the physician documents air embolism or amniotic fluid embolism or blood clot embolism or embolism NOS or fat embolism or pulmonary embolism or pyamic embolism or septic or septicopyamic embolism or soap embolism following incomplete spontaneous abortion, the code is O03.2. Next, O03.30 indicates unspecified complication following incomplete spontaneous abortion. And O03.31 indicates shock following incomplete spontaneous abortion, or circulatory collapse following incomplete spontaneous abortion, or shock post-procedural following incomplete spontaneous abortion. The next code is O03.32. Renal failure following incomplete spontaneous abortion. If the physician documents kidney failure, acute kidney failure following incomplete spontaneous abortion, or oliguria, or renal shutdown, or renal tubular necrosis, or uremia following incomplete spontaneous abortion, the code is O03.32. And if the physician documents metabolic disorder following incomplete spontaneous abortion, the code is O03.33. Next, O03.34 indicates damage to pelvic organs following incomplete spontaneous abortion. If the physician documents laceration, perforation, tear or chemical damage of bladder, or laceration, perforation, tear or chemical damage of bowel, or laceration, perforation, tear or chemical damage of broad ligament following incomplete spontaneous abortion, the code is O03.34. This is a continuation for O03.34. Laceration, perforation, tear or chemical damage of cervix, of periurethral tissue, of uterus or of vagina, any of the organ. The code is 03.34. Next, O03.35. It indicates other venous complications following incomplete spontaneous abortion. Next, O03.36. It indicates cardiac arrest following incomplete spontaneous abortion. Next, O03.37. This indicates sepsis following incomplete spontaneous abortion. And whenever we are coding sepsis, you need to code additional code to identify the infectious agent, which come under B95 to B97 series, and use additional code to identify severe sepsis, if applicable R62.2, and any associated organ dysfunction. That must also be coded when we are coding severe sepsis. The code is O03.37. Sepsis following incomplete spontaneous abortion. Next, O03.38. Urinary tract infection following incomplete spontaneous abortion, or cystitis following incomplete spontaneous abortion. Next code is O03.39. Incomplete spontaneous abortion with other complications. Next, coming to O03.4. It indicates incomplete spontaneous abortion without complication. This code we have discussed while discussing the retained products of conception. Whenever retained for the subsequent visits of retained products of conception without complication, for incomplete spontaneous abortion without complication, the code is O03.4. Next, O03.5. Genital tract and pelvic infection following complete or unspecified spontaneous abortion. 05. The fourth digit 5 indicates complete or unspecified spontaneous abortion. These synonyms are similar that we have discussed earlier. For endometritis, oophoreitis, parametritis, pelvic peritonitis, salpingitis and salpingo-oophoreitis following unspecified or complete spontaneous abortion, the code is O05.5. Similarly, for delayed or excessive hemorrhage following complete or unspecified spontaneous abortion, the code is O03.6. For embolism following complete or spontaneous abortion, the code is O03.7. And whenever the physician documents any of the below listed terms, you need to use the appropriate code that is in this row. And similarly, when the physician documents amniotic fluid embolism following complete or unspecified spontaneous abortion, the code is O03.7. This is a continuation and further synonymous terms for O03.7. Next, O03.80. It includes unspecified complication following complete or unspecified spontaneous abortion. Next, O03.81 indicates shock following complete or unspecified spontaneous abortion. And O03.82 indicates renal failure following complete or unspecified spontaneous abortion. And whenever the physician documents either renal shutdown or renal tubular necrosis following complete or unspecified spontaneous abortion, or uremia following unspecified or complete spontaneous abortion, the code is O03.82. Next, if the physician documents metabolic disorder following complete or unspecified spontaneous abortion, the code is O03.83. And for damage of pelvic organs following complete or unspecified spontaneous abortion, the organs include bladder, bowel, broad ligament, cervix, vagina. For all these cases, the code is O03.82. For periurethral tissue, uterus, for the laceration, perforation, tear or chemical damage of organs for pelvic organs, the code is O03.84. Next, O03.85 indicates other venous complications following complete or unspecified spontaneous abortion. Next, O03.86 indicates cardiac arrest following complete or unspecified spontaneous abortion. And O03.87 indicates sepsis following complete or unspecified spontaneous abortion. Whenever we are coding sepsis, use additional code to identify the infectious agent and R65.2 to identify severe sepsis. And whenever we are coding severe sepsis, you need to code the associated organ failure also whenever we are coding sepsis. Next, O03.88 indicates urinary tract infection following complete or unspecified spontaneous abortion. O03.89 indicates complete or unspecified spontaneous abortion with other complications. And finally, O03.9 indicates complete or unspecified spontaneous abortion without complications, miscarriage and spontaneous abortion NOS. The code is O03.9. Now let us see examples. Patient presents for follow-up of uremia following spontaneous abortion. Here the physician simply documented spontaneous abortion. He did not specify whether it is complete or incomplete. So you need to code unspecified spontaneous abortion. And the code is O03.82. Renal failure following complete or unspecified spontaneous abortion. Because under this code you will find the synonymous term uremia following complete or unspecified spontaneous abortion. So the code is O03.82. Second example, patient presents for follow-up of soap embolism following spontaneous abortion. Here also the abortion is unspecified. They did not specify whether it is complete or incomplete. So you need to go for unspecified spontaneous abortion. And the code is O03.7. Embolism following complete or unspecified spontaneous abortion. Under this you will find soap embolism following unspecified or complete spontaneous abortion. So the code is O03.7. Now coming to complications following termination of pregnancy. The codes regarding the complications following termination of pregnancy which are given by O04 dot series. So O04.5 indicates genital tract or pelvic infection following termination of pregnancy. Previously it was spontaneous abortion. Now it is a elective abortion, that is induced termination of pregnancy. So O04.5 indicates genital tract or pelvic infection following induced termination of pregnancy. Here, except induced termination of pregnancy, all the synonymous terms are similar. If the physician documents endometritis, oophorytis or parametritis, pelvic peritonitis, salpingitis or salpingo-oophorytis following termination of pregnancy, induced termination of pregnancy, the code is O04.5. And similarly, O04.6 indicates delayed or excessive hemorrhage following termination of pregnancy. And whenever the physician documents any of these synonymous terms that are under this code, you need to code O04.6. Next, O04.7 indicates embolism following termination of pregnancy. It can be air embolism or amniotic fluid following termination of pregnancy, or blood clot embolism or embolism NOS, or fat embolism or pulmonary embolism or pyamic embolism, or septic or septicopyamic embolism or soap embolism following termination of pregnancy. For all these things, the code is O04.7. Next, O04.80 indicates induced termination of pregnancy with unspecified complications. Whereas O04.81 indicates shock following termination of pregnancy or circulatory collapse or post-procedural shock following induced termination of pregnancy. And O04.82 indicates renal failure following induced termination of pregnancy. It can be kidney failure or oliguria or renal shutdown or renal tubular necrosis or uremia following termination of pregnancy. If the physician documents any of these terms following the termination of pregnancy, the code is O04.82. Next, O04.83 indicates metabolic disorder following induced termination of pregnancy, and O04.84 indicates damage to pelvic organs following induced termination of pregnancy. The damage can be to bladder, bowel, broad ligament or uterus or vagina, etc. Next, O04.85 indicates other venous complications following induced termination of pregnancy, and O04.86 indicates cardiac arrest following induced termination of pregnancy, and O04.87 indicates sepsis following induced termination of pregnancy. And whenever we are coding sepsis, the guideline is same. You need to use additional code to identify infectious agent and additional code to identify severe sepsis if severe sepsis is present. The next is O04.88, urinary tract infection following induced termination of pregnancy, or cystitis following induced termination of pregnancy. And finally, O04.89, induced termination of pregnancy with other complications. Now let us see examples. Patient presents for follow-up of metabolic disorder as a result of termination of pregnancy. So the code is O04.83, metabolic disorder following induced termination of pregnancy. Next example, patient presents for follow-up of endometritis after termination of pregnancy. So the code is O04.5, genital tract or pelvic infection following induced termination of pregnancy. Under this you can find the term endometritis. So the code is O04.5. Now coming to O07 series, it deals with complications following failed attempted termination of pregnancy. So O07.0 indicates genital tract and pelvic infections following failed attempted termination of pregnancy. Here I am not going through all the synonymous terms because we have been discussing it for the couple of series. So O07.0 indicates genital tract of and pelvic infection following failed attempted termination of pregnancy. And whenever the physician documents any of the below listed terms, the code is O07.0. And O07.1 indicates delayed or excessive hemorrhage following failed attempted termination of pregnancy. Next, O07.2 indicates embolism following failed attempted termination of pregnancy. And if the physician documents any of the below listed terms after failed attempted termination of pregnancy, the code is O07.2. And O07.30 indicates failed attempted termination of pregnancy with unspecified complications. And O07.31 indicates shock following failed attempted termination of pregnancy or circulatory collapse following failed attempted termination of pregnancy or post-procedural shock following failed attempted termination of pregnancy. O07.32 indicates renal failure following failed attempted termination of pregnancy. O07.33 indicates metabolic disorder following failed attempted termination of pregnancy. And O07.34 indicates damage to pelvic organs following failed attempted termination of pregnancy. That organ can be bladder, bowel, broad ligament, uterus or vagina, etc. And O07.35 indicates other venous complications following failed attempted termination of pregnancy. And O07.36 indicates cardiac arrest following failed attempted termination of pregnancy. O07.37 indicates sepsis following failed attempted termination of pregnancy. And you need to use these additional codes B95 to 97 and R62 whenever we are coding sepsis. And O07.38 indicates urinary tract infection following failed attempted termination of pregnancy. O07.39 indicates failed attempted termination of pregnancy with other complications. And finally, O07.4 indicates failed attempted termination of pregnancy without complication. Now finally coming to O08 series, which deals with complications following ectopic or molar pregnancy. And O08.0 indicates genital tract and pelvic infection following ectopic or molar pregnancy. All these are synonymous terms. Next, O08.1 indicates delayed or excessive hemorrhage following ectopic or molar pregnancy. Next, O08.2 indicates embolism following ectopic or molar pregnancy. O08.3 indicates shock following ectopic and molar pregnancy, and O08.4 indicates renal failure following ectopic and molar pregnancy, and O08.5 indicates metabolic disorders following an ectopic and molar pregnancy. O08.6 indicates damage to pelvic organ and tissue following an ectopic and molar pregnancy. The damage can be to bladder, bowel, broad ligament, cervix, periurethral tissue, uterus and vagina. Any of the case, the code is O08.6 following an ectopic and molar pregnancy. And O08.7 indicates other venous complications following an ectopic and molar pregnancy, and O08.81 indicates cardiac arrest following an ectopic and molar pregnancy, and O08.82 indicates sepsis following an ectopic and molar pregnancy. And whenever we are coding sepsis, you need to code additional codes for below listed scenarios. And O08.83 indicates urinary tract infection following an ectopic and molar pregnancy. O08.39 indicates other complications following an ectopic and molar pregnancy. And O08.9 indicates unspecified complication following an ectopic and molar pregnancy. Finally, coming to the new addition since October 2022, that is guideline regarding hemorrhage following elective abortion. For hemorrhage post-elective abortion, assign the code O04.6, that is nothing but delayed or excessive hemorrhage following induced termination of pregnancy. Do not assign the code O72.1, other immediate postpartum hemorrhage, as this code should not be assigned for post-abortion condition. You should not assign O72.1 or Z32.2, encounter for elective termination of pregnancy. Do not assign O72.1 and do not assign Z33.2 for the encounter for elective termination of pregnancy when the patient experiences a complication post-elective abortion. For the hemorrhage following elective abortion, the appropriate code is O04.6 and you should not code O72.1 or Z33.1. That is the guideline. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.